Homelessness is often viewed only through the lens of what we see on the surface, sometimes tents on sidewalks, or individuals holding signs, or people who seem lost in a crowd. Yet, every face is a story, sometimes marked by trauma, loss, survival, even a longing for dignity. Today, I want to pull back the curtain to look deeper into the emotional, psychological, and spiritual factors that contribute to homelessness, but more importantly, the pathways that can lead towards healing, restoration, and lasting hope. I want to uncover and dispel some of the myths that surround this topic and bring light so that we all have a greater understanding and how we can be part of the solution. Our guest today serves on the front lines, offering trauma informed care, emotional support, and compassionate advocacy to individuals fighting their way out of a desperate situation. You'll hear what truly makes a difference, how healing begins, and how we can each play a role in restoring hope to those who may feel forgotten or hopeless. Whether you've experienced instability yourself or you just want to better understand how to support those who do, this conversation will open your heart and strengthen your faith in the God who sees, knows, and redeems each story. Welcome to your hope filled perspective, where it's always our goal to restore hope, renew minds, and empower listeners to live in your God given identity. I'm your host, Dr. Michelle Bengtson, board certified clinical neuropsychologist, author, speaker, and companion on this journey to emotional and spiritual wellness. I'm so thankful you've decided to spend a few minutes of your week with us. Today, we are going to be talking about restoring dignity, how trauma informed support brings hope to the homeless. We'll dive into this important conversation right after this brief word from our. Too often, homelessness is reduced to statistics, stereotypes, or oversimplified assumptions about personal choices. But for many individuals, homelessness is the culmination of trauma, mental health challenges, broken systems, and overwhelming life circumstances. Today's episode invites you into a deeper, more compassionate understanding of the complex realities people experiencing homelessness may face and the emotional and spiritual tools that can help guide them back towards stability and purpose. My guest, Baron King, brings the unique blend of clinical expertise, lived experience, and heart centered compassion needed to walk individuals through some of their darkest moments. You'll hear about the role of counseling, the power of community support, and the importance of restoring dignity as part of the healing journey. Wherever you are today, I believe this conversation will remind you that no one is beyond hope, and God is still in the business of restoring lives, one intentional act of love at a time. In this episode, we are going to talk about restoring dignity, how trauma informed support brings hope to the homeless. I want to remind you of Isaiah 58, verse 10. If you spend yourselves on behalf of the hungry and satisfy the needs of the oppressed, then your light will rise in the darkness and your night will become like the noonday. Baron King is the current president and chief executive officer of the Chat Foundation, formerly the Chattanooga Community Kitchen. It's a nonprofit organization serving the homeless in the greater Chattanooga region. Prior to that, Barron served as the CEO of Liberty Ministries, Inc., which was a large nonprofit serving men and women inside state and county prisons of Pennsylvania and those upon release in residential transition programs. Prior to that, Barron served as Director of Health and Counseling Services, Clinical Director and Adjunct Professor of Psychology at Cairn University in southeastern Pennsylvania. He holds a BS degree in theology, an MS in clinical counseling, and has extensive background in organizational leadership and development. He's passionate about providing services and support to underserved people groups and providing pathways to self-sustainability. Welcome to the program, Baron.
Thank you, Michelle. Thanks for having me.
Many people assume that homelessness is primarily a housing issue. What deeper emotional, psychological, or systemic factors do you see contributing to chronic homelessness?
Yeah, well, I think to every complex problem, there's a simple answer, and it's always wrong. Housing, by and large is the single biggest systemic contributor to our housing crisis. And we could talk more about that. But it's rare that somebody presents themselves to our agency and the only reason that they are unsheltered or homeless is because of lack of housing. There's usually some other component, such as their income levels just don't match what the market can provide. Perhaps they have physical or psychological disabilities or challenges. So, a whole host, perhaps they're a caregiver of somebody that's dependent and they lack some of the social safety nets that other people have and they don't have. It's usually very multifactorial. When I started Chat Foundation, very much like what I've done in my last couple of roles, I said, hey, we're going to use a individual assessment approach because my organization provides over 30 services designed to support the daily needs of those experiencing homelessness, as well as putting people on a pathway to self-sufficiency. But most individuals we come in contact don't need all 30 services. And so it's important for us to make an accurate assessment of their strengths, their obstacles, their needs, and then try and customize a number of interventions that can get them secure, safe, housed, and then the opportunity to thrive.
From your clinical perspective, what are some of the most misunderstood mental health challenges that people facing homelessness frequently encounter?
I get this a lot, and I think before I entered this specific arena, I probably held some of these misconceptions. But a lot of people think that either substance use or mental illness is a significant driver of homelessness. Statistically, it's not so. The state of Tennessee estimates that about 20 to 25% of the homeless population in the state of Tennessee, where we're located, is struggling with mental illness. But if you look at mental illness rates in our general population, our housed population, we're talking 15 to 17%. And so while there is a slightly higher prevalence, it's not statistically significant enough to be a driver of that. We do come in contact with people with mental illness, but I think there's also a chicken and the egg
Yeah.
element to it. And here's what I would say. Do we see people that have lost their job, lost their income, and eventually lost their housing due to chronic mental illness? Absolutely. But I would propose that if any of us were unsheltered for 6, 8, 12 months, that we would be demonstrating signs and symptoms of depression, anxiety, and despondency. And I think that it's reasonable to assume that yes, mental illness is something that has to be taken into consideration when providing services. But correlation doesn't prove causation, right? 70% of the people that drove to work this morning and got in a car accident had breakfast before they left home. 70% is a pretty big number, but does that mean breakfast is causing these car accidents? No. That's what's important. And the other part of the drug or the mental illness component is, especially in certain states like Tennessee, where individuals with limited or no income have virtually no services for psychological or psychiatric treatment. And they're not going to be able to get in to see a doctor. If they need psychotropic medicines, they're probably going to be way more than they can afford because they're uninsured. And so that forces them into other choices of how to handle their symptoms. And oftentimes that becomes self-medication.
I would love for you to touch on the idea of Maslow's hierarchy of needs with respect to this population.
Yeah, so I get to speak a lot in Chamber of Commerce meetings, business clubs, things like this on the topic of homelessness. And usually before or after my presentation, somebody comes up and asks a question, and it usually starts with, why don't these people just? And it's fine. I don't mind the questions. I think they're trying to understand the problem better. So I appreciate the questions. But it's this idea that if they just did one thing differently, everything would work out. So Maslow's hierarchy of needs has been around for nearly 100 years now. And it's this premise that we have layers of needs, basically usually shown in a pyramid, where the bottom layer, the most basic layer, is physical and psychological safety. That if we don't have that, we can't reach our higher needs, which lead up to well-being and self-actualization. And a good example of this is if I get it in my head that I want to go to medical school and become a doctor, I'm going to be pushing myself. I'm going to be digging deep, trying to earn this goal, this really big, important thing in my life. But if I don't have some of my basic needs met, such as physical safety, psychological safety, my nutrition and my health, I'm not sure that I'm going to be able to climb that mountain effectively. And understanding what it's like to be homeless, but also unsheltered, and that's a big jump. Most of the people that we work with that are unsheltered have tremendous difficulty getting a restful night's sleep. They're outside under a tarp in a tent. People are trying to steal their things. They've been assaulted. They are just naturally anxious and scared. And so when I first started working at my facility, I was surprised how many people would come into our community center and come into the beginning of the day, lay down on the floor, and just sleep on the floor for maybe 4, 6, 8 hours. And I was like, wow, are they hungover? Are they nodding off on opiates? Are they just lazy? What I've realized is they can't sleep at night. And they come into our facility because they won't get assaulted and they can get sleep. Now, I don't know about you, but last night I went to bed at my normal time at 10:30. I got up, I had a good restful sleep, I had my cup of coffee, showered, got dressed, hit the garage door button, closed up my garage, and left knowing that my belongings were safe. That's what I do every day, and it helps put me in a good space to focus on what I have to do professionally, what I have to do as a father, as a husband. But if I'm just trying to survive, if I'm just trying to stay alive all night, all of a sudden my ability to do that simple thing of going to work is exponentially harder than it is for most people. The other thing too is people that are living on the streets, they'll have some clothes, they'll have some effects. They probably push around in a cart or a piece of luggage. But going to work means leaving what little things you have unprotected. And when you have nothing, what you do have is everything. And that's another challenge.
What are some of the everyday challenges people experiencing homelessness face that those in the general public may not realize? So that we can have more empathy and compassion, I think we need to recognize some of the things we don't know.
Yeah. Um, Definitely cleanliness and food insecurity is top of the list. If you're unsheltered, likely that you have no income stream or very little. You're maybe dumpster diving for food and exposing yourself to foodborne illnesses. But in cleanliness and hygiene is a big problem. We operate a pretty large community center. We have 16 showers, and throughout the day, people are just coming in, lining up to get a towel, getting a small piece of soap just to keep clean. I think one of the things that people really struggle with, and I think that most people probably wouldn't realize this, is a loss of identity. When people are homeless and they start to look a certain way, it's pretty typical that everybody else walking down the sidewalk gives them a wide berth, won't look them in their eyes. We're not interested in knowing their name, and they lose a bit of their humanity in the process. Our community center is where people come for services, come to get their mail, come to make phone calls, things like that. And a lot of the people that are in that facility are chronically unsheltered. And so there's been a lot of sadness. It's a pretty somber part of our facility. But we've partnered with Chattanooga State's School, and they come in on Wednesday mornings and give free haircuts. And on Wednesday mornings, the place is a place of joy. And why? Because they're getting groomed by another human being that's looking in their eyes, that's getting to know their name, that wants to hear their story. And they're smiling. For maybe 20 minutes, they feel human again. They feel worthy again. And I think Probably people understand the physical difficulties of homelessness, especially when the weather turns cold or when it's brutally hot or storms, things of that nature. But I think the psychological pain that individuals go through is pretty damaging. On one of my more recent podcasts on this topic, I talk about there's a word out there that I think is a killer to those experiencing homelessness, and that word is no.
Mm.
That the more often people apply for a housing voucher, assistance, disability, a handout, a job, and the answer is always no. We are wired. God made us in such a way that we have longings, we have desires. It's the way we're created. Scripture says hope deferred makes the heart sick. And so the longer we go without things we want, or more importantly, the things that we need, it creates a psychic pain. And what I've learned in my clinical years is human beings are really creative in finding ways to kill pain. And so individuals will start engaging in a process that essentially is trying to kill desire. Isn't that, let that sink in that if we want shelter so bad and we've tried for a couple of years to get shelter and it doesn't happen, I'm going to try and convince myself that I don't want it anymore because the longing is too painful. And one of the questions people ask is, don't people just choose homelessness? And I think it's more nuanced than that. No one chooses to be unsheltered. No one chooses to be homeless. But maybe we choose to stop trying. And that's not the same thing. That's not the same thing. We choose to stop trying because it hurts so darn bad.
Friends, we're going to take a short break for a brief word from our sponsor, but I want you to stick with us because when we return, we'll have Baron share more about what we may not know or understand about the homelessness epidemic. We'll be right back. Baron, can you share a story of perhaps transformation that illustrates how hope and support and therapeutic care can help someone break the cycle of homelessness?
Yeah, absolutely. This is a person I've learned a lot from. I don't have a former lived experience of homelessness, so that automatically puts me at a big disadvantage of somebody that's trying to be an expert on a problem I'm trying to solve. I've learned a lot from people that have experienced this. About 40% of our staff has a former lived experience of homelessness, and I'm very proud of that. We see ourselves as a vehicle to serve others, but also to help work with our staff and heal them in the ways that there's still work to do. But I came in contact with a young lady, we're going to call her Mary. She was a behavioral health specialist working for a local community health center. She wasn't a master's level therapist, but she has bachelor's training to provide mental health services to people. She had a good job. She never really touched drugs or alcohol, didn't have a substance use problem. A good friend of hers was having some of her own problems and had to go into a psychiatric hospital. And so Mary agreed to take over supervision of this young child. And this young child lived with Mary for about 5 or 6 years. The woman successfully got out of her treatment and was able and ready to take the child back. And when she did, Mary fell into a significant depression. A big part of who she had who she was and the life she had built was drastically changed, and she did not handle it well. She started missing work, eventually had to resign her position, and shortly after that became homeless. Mary lived on the streets for 7 years, was the victim of numerous assaults, sexual and physical in nature, and began to fear sleep. She began to fear sleep. And so she made it a goal that I'm just not going to fall asleep. I'm not going to fall asleep at night. And she started turning to substances to help her in that goal and ended up becoming a frequent user and addict of methamphetamine. Now, this is somebody without a drug history. This is not recreational drug use. This is, and to illustrate my point, a lot of times people think that homelessness is caused by people making bad choices. I would suggest that sometimes people don't have good choices to make. They only have four choices, and all of them come with pretty negative side effects. And she made the choice that to protect myself physically, I'm going to use this substance that I know isn't any good, but it's going to keep me awake. She had several hospitalizations. She experienced psychosis. She finally got herself clean, and then she finally got a housing voucher. And she's been 9 years clean and 8 years housed. And now she's gone back to working with us as a peer support specialist for those that are experiencing the same thing. So, how'd she do it? Her faith was a critical component that she never gave up. She never allowed her heart and her mind to turn bitter towards a better opportunity, a better situation. But she had people that helped her. She had people that stayed alongside her that never gave up. And I think it's a pretty interesting tale because I don't, I think it's changed the way I understand drug use in the homeless community. It's not that I condone it, but let's face it, Mary did not have access to legal things at the pharmacy that might have helped her. And so that's kind of her situation. But every time I see her in the building, it makes me so happy to say, here's somebody that has experienced the full experience, the full emotions of reaching rock bottom and then climbing out of it and wanting nothing but the best for people that are struggling with the same thing.
And my audience knows that I frequently talk about sacred scars, those really painful circumstances in life that God turns and uses for good. And Mary is doing that now by being a peer support counselor.
Yeah.
The worst thing she could go through in the hands of a redemptive God is now helping other people. But you mentioned Mary's faith. So, in your experience, what spiritual or faith based components are effective in helping individuals who go through such devastation?
Yeah, I think when we are at our worst, when the challenges seem insurmountable, I know for myself and other people, I tend to pull inward. I tend to have a downward gaze. It starts affecting my ability to have hope. And I think we constantly need to challenge ourselves to look upward and outward, to hold on to the truths that we know, to know that today isn't the end of the story, and that we serve a God that is in control of the universe and currently has me in this place. I think that is a key thing. I think community is really big. God made us for community for numerous reasons. And I know that isolation in the midst of suffering is one of the worst things that we can do. What Job needed wasn't people coming alongside him and telling him what to do. It was somebody to come along and sit and just say, I'm here.
Yeah.
I think that's a big part of it. A sense, in whatever ways we can, surrounding those that are suffering and being the hands and feet of Jesus and being that listening ear, being that shoulder. Yeah.
You mentioned the organization having over 30 services that you provide. Are there practical strategies that you teach to clients to help manage anything from anxiety to overwhelming life transitions?
Yeah, I'm always been a big proponent of partnerships. We're a nonprofit and we have limited funding. And so there's lots of things that we want to do that, boy, we just don't have the ability to write the check to make that happen. But there's other organizations that are providing services at a high level that have the additional capacity to take on some of our clients. And so we have an organization that is in town called First Things First, and they basically are a human education organization providing everything from training on nutrition to mental wellness to spiritual formation, financial literacy, parenting, all those types of things. And so we have programs running at our facility that address all of those. We try and look at the physical. We try and look at the mental and psychological. We look at the vocational component of this. We're currently in December of 2025 watching as nearly a dozen social service safety nets are being pulled back at the federal and state levels. And some of these programs made it easier to get people into housing. Now we're telling most people that it's going to be very hard to get a housing voucher, and housing is really going to have to come through income generation. So we developed with a grant from a great organization in the in town, a workforce development program to help people assess where they are with job skills, what kind of income do they need, building relationships with employers that are willing to give homeless individuals maybe what is their second, third, or fourth chance opportunity at employment. Because we recognize that, hey, we're not here just to band-aid the problem. We want people to thrive. And if they're underemployed, or if there's a way that we can get scholarships to attend the construction trade school in town. I know electricians and plumbers that are making really very good salaries. And I think sometimes our folks think that those doors are closed to them, that they don't have those opportunities. And so we try and make as many of those happen. We partner with two local bike companies that repair damaged, discarded, and donated bikes. And each year we give away about 100 bicycles to people in the community. And they primarily use those for two things, to get to a grocery store or to get to work.
Mm.
I love the network that we exist within because it makes us feel like, hey, we have created a one-stop shop for homeless services, which is what the research says is really necessary. And we do it in partnership with others in the community that can maybe do certain aspects of it better than we could.
But what I appreciate about each of those different pieces that you mentioned is it reminds me of the body of Christ.
Yeah,
Like we need all parts. And what you mentioned, there are so many creative ways that our people are being part of the solution.
yeah.
I want to talk more about how we can be part of the solution to the homelessness crisis right after this break from a word from our sponsor. Baron, for individuals who want to help,
Yeah.
but they feel overwhelmed, what are some meaningful, sustainable ways the community can support those experiencing homelessness?
Yeah, I think probably a lot of people feel that the problem has gotten so big, it's a little overwhelming. Can anything make a difference? And I would say every drop of water in the sea makes some bit of difference. And I would Google, what are your local homeless service support centers? Is there a shelter? If there's a shelter, I guarantee they need volunteers. I guarantee they need donations of clothing and food and financial donations. There are so many ways to get involved. If you're interested in how your state's legislature is either creating progressive legislation that helps solve the problem, or if they're criminalizing homelessness, you can pick up the phone and call your representative and say, look, I hear that we're charging people for public camping, but doesn't that give them a criminal record and make it harder to get them housed? So there's lots of things to do. I think what I've learned is we tend to keep our homeless neighbors beyond arm's reach. We keep them at a distance. And I came across this quote by Mother Teresa that I like to share because I think it's necessary if we're going to if we're going to approach this problem as a community of believers, but it's that we can't help them because we don't know them. I'm sorry. We can't help them because we don't love them. We can't love them because we don't know them. And we have an army of volunteers that they come in on a regular basis, either to serve meals, to work in the community center, to work in our clothing department. And what I see is they come in on their first time and they're scared. They're out of their element. It feels a little threatening, the environment, but they come with a couple people and they find out it's not so bad. And then they start seeing the look of appreciation and thankfulness on people's faces that are just trying to make it one more day. And then they learn their name. And then they realize, okay, I can make an impact. At the very least, I can look them in the eyes, smile at them, tell them I love them, and provide some level of dignity. Dignity is the first thing people lose when they become homeless. And it's hard for me to imagine that there's anybody in the United States that can't do something, whether it's a financial donation, donating food, donating clothing, getting involved as a volunteer, advocating for progressive homeless legislation.
For listeners who may be experiencing instability or emotional exhaustion or crisis themselves, what words of encouragement or hope filled perspective would you want to offer them?
Homelessness is, or the threat of homelessness is impacting people at a very high, an alarming rate. With last year's point in time count, we reached 771,000 people homeless on any given night in the United States. That's the highest number ever recorded. It still only equates to one half of 1%. And it seems like a big number at the same time. It seems like a small number, but we also have about 60% of the people who live in the United States are living paycheck to paycheck. And I think there's a high percentage of people that are either living very close to homelessness or have that risk of falling in. If their car breaks down, if they get laid off, they don't have the social supports, they don't have the capital supports that are going to keep them afloat. So if you are close to that place or have become homeless, the first thing I would say is you're not alone, and there are organizations that are out there to help. I would start asking everybody and ask for help soon because the longer you're homeless, life tends to fall apart. Usually, the people that we meet that got evicted yesterday, they still have a working automobile, they still have a job, their health is still intact, they haven't become depressed. But then 1 month, 2 months, 3 months later, the hits just keep on coming. And so early, quick intervention is always the best response to anybody struggling with homelessness.
Baron, thank you for coming on the program and sharing out of your expertise and experience to help dispel some of the myths and increase our understanding of this epidemic and what we can do to be part of the solution. In that vein, friends, I want to remind you of Proverbs 19, verse 17, that says, "Whoever is kind to the poor lends to the Lord, and he will reward them for what they have done." I'm hoping that this episode has increased your understanding, but also encouraged you that you can actually be part of the solution. Think about what you would want someone to do if you found yourself in that situation. There's something we can all do. Friends, thank you for joining me on this episode of Your Hope Filled Perspective. If today's episode encouraged you in some way, would you consider sharing it with someone else who needs a biblically based, hope filled perspective? I look forward to being with you again next week. And until then, you know it's my prayer for you that you have a hope filled week.